Good morning, everybody. I'm Tanya Peel with Respiratory HQ. Yesterday on social media, I posted this MBRC style question, and I got a couple of messages and emails from people asking if I would work through this, and I think that's a fantastic idea, so that's what we're going to do here in the next 5 minutes. So, you have a 43-year-old male with pneumonia on a 50% Vini mass that has the following ABG. pH is 7.49, CO2 is 30, PaO2 59, and a bicarb of 22. Which of the following is false? And that is a key word that we have to keep in mind. So when you're taking a test and the answer is which of the following is true, which of the answer following is false, what I would tell you to do is go down this list and actually label each and every one of these true and false, and then go back up to your question and remember what it's asking for. Okay, so we're looking for the false statement. So let's just start out with A. Acute alveolar hyperventilation is present. This is actually a true statement. And I know that it's true because a CO2 of 30, that's a low CO2, meaning the patient's blowing that CO2 off, and the pH is corresponding is increasing in alkalosis. So this is a classic example of hyperventilation. I know it is an acute condition because the bicarb is still in its normal range. It hasn't decreased in an attempt to provide any compensation. So an acute condition is one that comes on so suddenly that the bicarb hasn't had a chance to fix the situation. So that is a true statement. Second statement is that hypoxemia is causing a respiratory alkalosis. Well, acute alveolar hyperventilation is really a fancy way to say a respiratory alkalosis. So we do have a respiratory alkalosis. The question is it caused by hypoxemia? And this is also a true statement because one of the body's first responses to hypoxemia is to increase respiratory rate. And when you increase respiratory rate, you blow off the CO2, so CO2 will decrease and pH should increase. That is exactly what's happening here. So that's a true statement. So this is where I'm going to say, let's use some test taking skills also. Let's say you're a little bit iffy on your acid-base balance, or maybe you haven't started the program yet and you really don't know what these words even mean. So let me show you kind of how to look at this. If you just look at this question and you don't know what A or B, you come down to C and D. And I'll just tell you, if you watch the video that's on YouTube, what hopefully you got out of that is anytime there's an oxygenation issue, and we do have an oxygenation problem, right? We're on a 50% Vini mask and our patient's PaO2 is 59. We have moderate hypoxemia. That is always going to change the A to A gradient in some manner, okay? So you can't have both an increase and a decrease A to A gradient. It's going to have to be one or the other. So just looking at the question, you can almost narrow it down to C and D because we can't have both of these. All right, so that narrows it down to a 50-50 chance if you're having to guess. But let's just focus on this A to A difference and how to use that terminology. I'm going to tell you, it would really benefit you if you go to my YouTube channel, Respiratory HQ, because there I'm going to explain the usage of that term. The MBRC will use the A to A differences increase, the A to A differences decrease, and they expect you to know what that term means. So there's a 5-minute video that's going to clarify that for you. If you've already watched it, hopefully the main thing that you got out of it is when that A to A difference increases, it's a bad thing. Something's going on in the alveoli to keep oxygen from diffusing into the capillary bed. So we have oxygen on the patient, but their PaO2 shows moderate hypoxemia. Well, that's not good, all right? Which means the A to A difference, if it's increased, that's bad, all right? So A to A differences increase is also a true statement. So that leaves C. The A to A difference is decreased. Now let me just show you this with a little bit of math, okay? And you might want to check my math because I've been known to do this wrong. But here is our alveoli and here is our pulmonary capillary bed. Let's just do room air first, okay? When we're calculating the P big AO2, barometric pressure minus water vapor pressure times the FiO2. So we're going to do this on 21%. Now, if you're not given the barometric pressure and you're not given a CO2 on a blood gas, you're going to need to assume absolutely normal values, okay, or barometric pressure, assume 760. So 760 minus 47 times 0.21 minus the CO2, and we're calculating this on room air, so we're going to say the CO2 is 40 times 1.25. And that makes our PaO2 roughly right about 100 millimeters of mercury. Well, a normal P little aO2 is 80. So the mathematical difference between the two, okay, so this is just the mathematical difference, 100 minus 80 is 20. All right, so what you should get out of this is when this number is small, that's a really good thing. That means diffusion across the AC membrane is very efficient. Now, this situation that we have going on right here in the example test question, our patient is breathing an FiO2 of 50%. So now when we calculate the P big AO2, barometric pressure 760 minus water vapor pressure 47, that answer times 0.5. From that, you subtract the CO2, which on this blood gas was 30. So minus 30, and take that 30 times 1.25, and when you do that, you have a P big AO2 of about 318. All right, but the blood gas says that their P little AO2 on this 50% is 59. So this patient's A to A difference, 318 minus 59 is right around 259. All right, so if you're comparing this to what normal is on room air, when we add oxygen, do you see how this mathematical difference has increased? Okay, so this person's PA to A difference is increased, which is why D is a true statement. Remember, we're coming back up and we're looking for the false statement. That's your false statement. So I hope this has helped. I'm going to post one of these every week for the next, 10 or 12 weeks, and I'll follow it up with an instructional video also. So I hope you found it helpful. See you soon.